The Sustainable Development Goal 3 focuses on good health and well-being. Goal 3.3 is oriented on fighting communicable diseases. By 2030, this goal aims to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. HIV stands for Human Immunodeficiency Virus. This virus targets the immune system of the infected. This causes the infected person to have acquired immunodeficiency syndrome, also known as AIDS. The HIV virus targets white blood cells of the body. The virus destroys the white blood cells, causing the immune system to be weakened. Due to the weakened immune system, the patient is more prone to opportunistic diseases. In most cases, the patient dies. The main causes of AIDS is unprotected sex, sharing of infected needles, and transmission of AIDS from an HIV-positive mother to the baby. Although HIV has been discovered for many years, the cure for HIV is still unavailable. Some has claimed to be cured of HIV, but there is lack of evidence to support this claim. As of now, HIV patients are prescribed antiretroviral medication to alleviate the symptoms. Since the discovery of HIV and AIDS, many efforts have been made to combat the spreading of this disease. Countries all across the world have pledged $14.25 billion to end the spreading of communicable diseases, including AIDS. Besides that, recent development in medical research allows for more exploration for the cure of HIV. Rapid progress in research backed by the fundings will allow the possibility of a true cure for HIV in the future. Communities must also educate each other about the prevention of AIDS. Spreading awareness of the dangers and prevention of AIDS is an important aspect in the global fight against AIDS. However, there are setbacks that halt the progress towards an HIV-free world. One of the main factors is the harmful stereotype surrounding AIDS. Whenever HIV or AIDS is mentioned, society would immediately link it to the LGBTQ community, especially gay men. Society often assumes that homosexual sex is the main cause of HIV spread, despite heterosexual sex actually being the main cause of transmission. HIV-positive individuals are often ostracized by their surrounding community. People assume that HIV is transmissible by touch, which is not true. Thus, the HIV-positive individual is isolated and casted away. However, with the recent awareness raised by campaigns and education, more people are beginning to see HIV-positive individuals in a more positive light. Now, HIV patients are able to receive the support needed to survive the disease. To conclude, the global fight against AIDS is a long, ongoing fight. However, with sufficient funding, development in medicine, and support and care from surrounding communities, the SDG 3.3 goal to eradicate communicable diseases may be fully realized.